everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about HIV in children. So let's get started. Now, HIV means human immunodeficiency virus. So in the name itself, you can see that there is immune deficiency virus. That means it is a virus which affects our immune system. So basically, this HIV virus or the human immunodeficiency virus is a virus that targets the cells of the immune system. So if any virus or, for example, any foreign pathogen affects or attacks our immune system, what would happen? Over time, our immune system would fail, right? And that is called as immunodeficiency, because your immune system would not be able to work properly. So when your immune system is not working properly, what would happen? There would be infection, right? So the person would get frequent infection. So if we see a healthy individual who is having a healthy immune system, they would be easily able to fight with the infection, right? But in case of a person who is infected with HIV, for them their immune system is actually attacked. They have immunodeficiency, right? So because of that, they would be more vulnerable, or we can say there would be increased risk of getting infection or tumors. So basically, this is a virus which actually attacks our immune system, and because of that our immune system fails, and that is why we would have immunodeficiency, and because of that it leads to AIDS, which is acquired immunodeficiency syndrome. Right now, here we are talking about pediatric patients, right? So in pediatric patients it is actually very rare, but in some cases we can see that there is a chance that pediatric patients also might be affected with AIDS or HIV. So let us move on to the causes to understand what are the causes that might actually cause HIV in children. Well, the first thing which is very important is from mother to fetus transmission. So that means if a pregnant mother is infected with HIV, then there is a high chance that the mother can actually transmit the virus to the child. Now, this can happen during certain times, right? For example, during the pregnancy, right? So, during through transplacental route, it can transmit to the child, and also during the labor or delivery, and also after the during the postpartum period, during breastfeeding also, there is a high chance that if the mother is having HIV infection, then the mother can transmit it to the child also. And the next one is during blood transfusion. So, if in case, if we transfuse infected blood which is infected with HIV infection, if we transfuse that blood to a child, then definitely the child would get HIV infection. So this is again another cause of HIV transmission. Now next, let us discuss what are the timing of HIV transmission. As we are discussing about pediatric patients here, so as I told you that the chances of getting HIV for children is very, very less, right? Because mostly if we see the causes in adults, it is mostly transmitted through unprotected sex. So here in pediatric patients it is very less unless until and unless the child is sexually abused, right? So here there are specific times where when the transmission can actually happen. So the first thing is intrauterine period. That means during the pregnancy, through transplacental route, again the virus can transmit to the child. Next is intrapartum. So during the delivery, again there is a high chance that there might be the infection, the virus, HIV virus, that can actually transmit to the newborn. And then postpartum period. So a mother who is infected with HIV, if that mother breastfeed her child, then definitely through breast milk, it can again transmit to the infection, or the virus can again transmit to the child. Now let us understand how this HIV, the mechanism, how this HIV or the human immunodeficiency virus attacks our immune system. So we are saying that, it targets our immune system, it attacks, it kills our cells of the immune system, and that's the reason our immune system fails, right? So let us understand it in a more detailed way. So it basically, when we are saying that it attacks our immune system, or it attacks the cells of our immune system, we're actually saying that it attacks the cells that have CD4 receptor on its surface. So basically the cells which actually have the CD4 receptors, or CD4 molecule on their surface, those cells are attacked by HIV virus. Now, what are these CD4 molecules or CD4 receptors? So these cells are basically, these cells attach to and communicate with other immune cells, which is particularly important when the cells are launching attack against foreign pathogens. So basically, whenever there is an infection in the body, or there is a foreign pathogen inside the body, what happens? Our immune system, the cells of the immune system start to attack that pathogen, right? So how does that happen? That happens with the help of these CD4 cells, because these help those cells of the immune system to attach to and communicate with other immune cells. So we said that it attacks the cells which has CD4 molecules on its surface, right? So that means mostly it attacks the helper T cells, because it has lots of CD4 cells on its surface. So apart from helper T cells, it also attacks attacks other cells with the CD4 receptors, such as macrophage, monocyte, and dendritic cells. Now, I mentioned that it attacks the helper T cells because it has lots of CD4 molecules on its surface, right? So, what does this helper T cells does? It is a WBC, right? It is a white blood cell, and you know that all these white blood cells are very important to fight with the infection. So I mentioned that this HIV virus attacks the helper T cells, right? Mostly because it has lots of CD4 molecules on its surface. Now this helper T cells is actually is a WBC, right? It's a white blood cell. That means it helps us to fight with the infection. So once this, what happens? This HIV virus, it attacks the helper T cells. That means it gets inside the helper T cells, and once it gets inside, it actually hijacks the T cells machinery, and once it hijacks the T cells machinery, it can actually manage to insert its own genetic material into the cell's DNA. And then there it would start to replicate, and it would start to make lots and lots of HIV molecule, right? So that's how it would replicate, and that's how it would increase their number inside the body. So what is happening here? The HIV virus is actually going inside the helper T cells, and then it is actually hijacking its machinery, right? And it starts producing its own molecules, lots and lots of HIV molecules, right? So once it has produced enough number of HIV molecules, what would happen? It would start to kill all these T cells. So over time, it would start to kill the T cells, and the person would be at high risk for infection, because we know that these helper T cells are actually, it helps us to in fighting with the infection, right? So if these cells are not there in the body, then definitely the person would not be able to fight with the infection. So the person would be at higher risk for infection. And here, which is very common that you can see in patients with HIV infection, that they would start to have opportunistic infection because their immune system is being attacked, right? And their T cells are being killed. So obviously they are they are at high risk for infection, and they would start to have opportunistic infection, which is very common in children or in person who is infected with HIV. Next, let us move on to the types of HIV. So basically we have two types of HIV, that is HIV-1 and HIV-2. So HIV-1 is very common and it is associated with AIDS, right? And HIV-2 is actually very rare. We cannot see HIV-2 more in children or more in adults also. So HIV-1 is very common and it is associated with AIDS. Well, next let us understand the stages of HIV infection or AIDS. So as I told you that, it's a kind of process, right? The HIV virus gets into the body and then it starts to replicate, and then eventually the person would have AIDS actually. So it has different stages. It has several stages. So the first one is acute stage. Now this stage begins about a couple of weeks to a month after becoming infected, and it can spread to others. So during this stage, the person can infect others, or the person can actually spread the infection. And also in this stage, the person would have flu-like symptoms. So you can basically see that the child would have, joint pain, fatigue. Also, the child might have GI upset or aches. Then the child would also have fever, headache, and rash. There would be sore throat, and the lymph nodes would be swollen. The next stage, or the second stage, is chronic stage. So in this stage, the signs and symptoms may disappear, but the child can still transmit the virus to the other person. And here you cannot see any opportunistic infection. So there would be no opportunistic infection present. And the last stage is AIDS, which is acquired immunodeficiency syndrome. So here, this stage develops when the immune system is actually destroyed by the virus. So here the person is actually immunodeficient, and also it can transmit easily. The virus or the infection can transmit easily, and this is a very, very severe stage, we can say, where the child needs immediate treatment, and without treatment the child cannot survive for more years. Well, next let us move on to the management of AIDS, or management of HIV infected child. So the management of HIV infected child includes several modalities. In that, the first thing is prophylaxis. Second thing would be the prophylaxis means here cotrimoxazole prophylaxis. The second thing would be antiretroviral therapy. The third thing would be treatment of opportunistic infection, because the child would have opportunistic infection, right? So we also have to treat that along with treating the HIV infection. And then we have to make sure that the child is having adequate nutrition. And then the last one would be immunization. So first let us discuss about the cotrimoxazole prophylaxis. Now here, all the HIV exposed infants would start taking cotrimoxazole at 4 to 6 weeks of age, and it should be continued until HIV infection can be excluded. And all children who begin cotrimoxazole prophylaxis should continue until the age of 5 years, when they can be reassessed. Next, let us discuss about the antiretroviral therapy. So here you have to remember that this does not eradicate the virus and cure the child, but rather it suppresses the virus replication for extended periods of time. Now in antiretroviral therapy, we actually have main 3 groups of drugs. That is, the first one is nucleoside reverse transcriptase inhibitors, that is NRTI. The second one is non-nucleoside reverse transcriptase inhibitors, that is NNRTI. And the third one is protease inhibitors, PI. So first we would see in NRTI, that is nucleoside reverse transcriptase inhibitors. What are the drugs that we have? Well, first let us see what are the drugs that we use in NRTI, which is nucleoside reverse transcriptase inhibitors. So in that we basically use zidovudine, lamivudine or stavudine. Apart from this, we also have abacavir, and then in NNRTI, which is non-nucleoside reverse transcriptase inhibitors, in that we have nevirapine and efavirenz. And then in protease inhibitors, so we have lopinavir, amprinavir, and then indinavir, ritonavir, etc. Next, let us discuss about the nutrition. So here, it's very important to provide adequate nutrition to these children who are infected with HIV, and many of these children would have failure to thrive. So to prevent that or to manage that, you have to make sure that they have adequate nutrition. Next is immunization. So immunization schedule should be up to date. So whatever the vaccines are there in the national schedule, and all those vaccines should be given to the child unless the child is symptomatic. So symptomatic HIV children should not be given oral polio vaccine and BCG vaccine. Next, let us discuss about the prevention of mother-to-child transmission. Now, as I told you that for children it is very rare until and unless they get it from their mother. So, in case a pregnant mother is infected with HIV, in that case, how to stop this transmission? Because we know that there is a high chance that this virus can transmit to the child, right? So, during that time, what we can do or how we can prevent it? Let's see. So the first thing we have to do is we have to start antiretroviral therapy, right? And then we have to make sure that the mother takes this therapy during the pregnancy and even after the delivery and thereafter. So the recommended regimen for pregnant women with indications of ART is actually combination of zidovudine, lamivudine and nevirapine. And then we have to see how we can prevent it in the intrapartum intervention period, right? So what are the intrapartum interventions that we can take? The first thing would be delivery by elective cesarean section at 38 weeks before onset of labor, and rupture of membrane should be considered. We also have to avoid artificial rupture of membrane, and we have to avoid procedures which would actually increase the risk of exposure the child to maternal blood. And then the next thing is breastfeeding. So here you have to make sure that if the mother is infected with HIV, the mother should not breastfeed the child, because HIV virus can actually transmit through breast milk also. So we have to make sure that the mother does not breastfeed the child. Well, next let us move on to the nursing intervention. So nursing intervention, the first thing that we have to do would be screening the child properly, and even screening the pregnant mother properly. So when the pregnant mother comes for checkup, you have to make sure that you check them thoroughly and you understand if the mother is having HIV infection, because then there is a chance that the child would be also infected with HIV, right? So to stop that, the first thing that you have to do would be screening them properly. And even the children who comes, you have to screen the newborns properly, that whether they have any sort of signs and symptoms of opportunistic infection. So that would, if we can diagnose it earlier, then we can start the antiretroviral therapy earlier, right? So you have to screen the pregnant mother and the child properly. Next would be educating the parents. So in case if there is a child who is infected with HIV infection, probably the child has got the infection through blood transfusion, and the parents that don't have any idea about AIDS or any idea about HIV infection, right? So in that case, you have to educate them and how important it is to stop, the spread of infection, right? How they can take care of the child and what are the things that they have to consider, they have to take care. So you have to educate them about their child's condition, about the how the disease progress, and then you have to monitor the child. So if you have a patient, a child who is infected with HIV, and we learned that, there are several stages. There would be acute stage, there would be chronic stage, and then there would be AIDS, right? So there is still time to develop AIDS, and AIDS is a very severe form, right? So we don't want that. So to stop that, definitely, if you have a child who is in the acute stage or probably in the chronic stage, you have to make sure that you monitor the child carefully so that the disease doesn't progress there. The next thing would be advise the mother not to breastfeed. Now, every mother, they want to breastfeed their child, right? They pretty much understand that how important breast milk is for their child. So they might not understand that the infection that they are having, that can actually transmit through breast milk. So as a nurse, it's your responsibility to make them understand that in this case, if they breastfeed the child, it would actually harm the child, right? So they should not breastfeed the child at any cost, and you have to make them understand this. Next would be drinking water from treated source. So here, as you know, that their immune system is attacked, right? Their immune system is not functioning properly. They're immunodeficient, so they are not able to fight with the infection, right? And that's the reason they would have opportunistic infection. So it's very important for them to drink water from treated sources so that you can avoid infection. So all these things you have to make the parents understand, as well as you have to some sort of educate the child that they should not drink water from anywhere. They should drink water only from treated sources. Next thing is they should not eat foods which are raw or unpasteurized, and this can harm the child. The child can again acquire infection from that. So you have to make sure whatever the child is having, the child is eating or drinking, it should not carry any sort of microorganism. It should not carry any infection. Next would be keeping the vaccines up to date. So, as I told you that, we have to maintain their immunization schedule, right? So, we have to make sure that the child is receiving all the vaccines until and unless the child is not symptomatic. So, if the child is symptomatic, in that case, we would not give oral polio vaccine and BCG vaccine. But apart from all these things, we have to make sure that they receive their vaccines, because again, their risk of infection is quite higher, right? They can acquire any sort of infection. So in that case, if their immunization schedule is not up to date, in that case, there is a chance that they can get those infections, right? So to avoid that, we have to make sure that they receive all the vaccines. And the last one is need to take ART, antiretroviral therapy. So this is something which is, which would not eradicate the disease, not cure it, but definitely it would, it would stop the progression of the disease, right? So you have to, educate the parents about that. You have to make sure that the child is taking all the drugs which are prescribed. The child is not missing any dosage, and you also have to make sure that the parents understand that, skipping the medications, how it can harm the child, right? So they have to understand. You have to make them understand that, how important it is to take these medications at proper time. Well, so that's all about today's class. Now let us conclude our today's topic here. So today we learned about HIV in children, which is human immunodeficiency virus, right? Now, this is something which actually attacks our immune system or the cells of our immune system, and because of that, our immune system fails. That is what is called as immunodeficiency. And over time, what happens because of this, the person develops AIDS, which is acquired immunodeficiency syndrome. So I hope you have got a better insight about the topic. Thank you.